I'm definitely feeling better than I was before the program. That's for sure. My mood is probably the best improvement. My energy is better. You know, the more I learn about everything you're saying, I think I was having like pretty severe symptoms that just like have not been acknowledged by anyone. Like that's why I was asking about the blood vessel inflammation, because that was something I noticed like a month ago. I was trying to exercise and I had like pulsing in my arms, like so much numbness and tingling, and like all my blood vessels felt like inflamed. That's how I would describe it. And even in my head and things like that. And everyone would just kind of say, oh, you're just stressed out, or I don't know, like nobody could ever give me an answer. And so I feel like things have started to affect all different parts of my body, and it might just take me a while to really make it start to go away.
But your body has to have the tools to repair itself. And that's what we're building that up right now, that we're healing every single cell in the body. But especially like we talked about, we want to shift that inflammatory immune pathway where you had more inflammatory immune cytokines, the TNF alpha and gamma being released compared to interleukin 10, which is anti-inflammatory. So we're going to balance out that ratio. So there is something inflammatory going on.
I know it's hard for me to trust, because I just felt like I've been shuffled around. Every doctor just tells me, oh, you're just stressed out, you're just stressed out. But I can feel in my body that like there's more going on besides just my stress. And then I get more stressed because of it. So I think that's what's caused the inflammation to keep getting worse and worse and worse. And everything you're telling me makes sense. Like the inflammatory pathways, when I watch the videos, it all makes sense to me. So I'm like, okay. But then on the flip side, I'm like, if this really works, why aren't you guys making billions of dollars? And why isn't everybody coming to you? Like, you know, why am I on a 3-month waiting list for a rheumatologist who's just going to give me an immunosuppressant drug, but not really cure me? I supposedly had psoriasis, and I never knew it, because I always thought I had like a mosquito bite, and now I realized that was psoriasis. You know what I mean?
So like paying more close attention to that as the days go on, so it will help us get clarity if we do have to change anything. But in terms of what you're doing with your nutrition, you're doing it perfectly.
It was really bad. I had episodes of feeling like I told my husband, I feel like I'm having like a mini stroke, but no one believes me. And that's how I would feel. Like I would get nauseous. I would feel a little out of it, and kind of like everything was fuzzy. And then it would slowly go away, but it wasn't like I was going to faint, but kind of. It was very hard to explain. And then I would like feel okay again. And I just had all these crazy symptoms. And now I'm learning that so much of it is probably what is going on inside my body. So I think going on the steroids helps that, because then those episodes started going away. And now doing this, you know, I haven't had that at all. Don't want to jinx it. Overall, I do feel better.
That's good. Yeah, so like we talked about, steroids, they suppress your immune system, but they suppress the entire immune system. That's why you don't want to be in it for too long. So it doesn't fix the problem, it just suppresses your immune system. If your immune system is targeting your organs, people have pain, inflammation, and that's what it suppresses that, but it doesn't fix the problem. And with us, we're fixing the way your body functions, giving your body the tools that it needs to repair itself. You're going to have very low inflammation in the body eating this way.
Yeah, I think a lot of mine is chronic stress, because I had 3 miscarriages this year, which now I think was due to immune issues. But then with each one, I got more stressed out, and it kind of got worse and worse and worse. And then all the symptoms really showed themselves after this last one. I know that of course I want to have a successful pregnancy, but I want to be healthy. I know that means that these miscarriages mean that it's something, you know, wrong with my health that needs to get addressed before I even try that, because I don't want to get pregnant and then cause more complications in my own body. I want to be healthy before I even try that. My ANA was negative. All the other stuff was negative, but yeah, it was just these ratios that you're saying that were out of balance.
Yes.
I have a rheumatologist right now, but I just don't really like them, because I feel like they just tell me, stop being stressed out, you're fine. And they don't, I don't know.
So it's, you can still heal at rapid rate. Like I mentioned, a client, Rudy, he's 70 years old and he had multiple autoimmune issues. They diagnosed him with oligoarthritis, arthritis, rheumatoid arthritis. He had so many antibodies. It wasn't just ANA. It was centromere positive. It was dsDNA. He had so many antibodies attacking all different parts of the organs, and he was able to get better and get off his steroids. We had people who were so sick and they recover really fast, but then other people who haven't been sick for so long, it takes them longer. It really depends. If you've been in remission and you just started having symptoms.
I mean, I felt fine until the pregnancies. And I know you said that a lot of times it happens after a pregnancy, which is what my other doctor said. And, you know, I had 3 pregnancies in 9 months, and I feel like that probably caused a lot of my issues. I mean, could that be a thing? Is that
Yeah,
true?
absolutely. Yeah, because the hormones change during pregnancy, and we have one of our clients. She had Hashimoto's for decades, and then she had 3 kids, and then she got fibromyalgia and asthma. But she recovered. She never thought she was gonna get better, but she'd been symptoms. Within 2 weeks, her asthma was gone. Her pain completely was almost insignificant. Her energy levels were high. I mean, she recovered so fast, even though she had Hashimoto's for years. It was like 10 years. It's because her doctor just told her you'll be fine when you take steroids, but then she got pregnant because her hormones got triggered. She got another autoimmune disease. Get better, like I mentioned, we haven't had anybody work with us. Nothing changed. There's always some kind of improvements, whether they're symptoms, they're lab markers. It's the best thing you can do for yourself in terms of your nutrition.
Okay. Thank you guys very much.
Nice meeting you.
You're welcome. Good to see you. Bye.